Today I'm visiting Medik Hair, located inside Guadalpin Suites Hotel on Marbella's Golden Mile, to try a PRP treatment for the scalp and hopefully stimulate healthier hair growth naturally. Lately, I've definitely noticed my hair becoming thinner and weaker than before, something so many people quietly struggle with. So I wanted to learn more about the PRP and experience the process myself, because I've tried it for my skin and I've seen how good it works, so I can only imagine what it can do for my hair. What makes Medik Hair unique is that it's actually the only hair clinic in Spain located inside a 5-star hotel, creating a much more private and relaxing experience from the moment you walk in. The process starts with drawing a small amount of blood, which is then placed into a small centrifuge machine. Over the next 10 minutes, the machine spins the blood at high speed to separate the platelet-rich or concentrated plasma, you can say, from the red blood cells. And this golden plasma is rich in natural proteins and nutrients from your own blood that may help improve scalp health and support stronger, healthier hair growth. And yes, I even had the honor of opening the machine myself. Listo, ahora. Cool. ¿Cuál? Los dos. Wow. Once the platelet-rich plasma is ready, it's carefully drawn into syringes before being injected into the scalp. The treatment uses your body's own natural growth factors, which is why PRP has become increasingly popular for people experiencing hair thinning, shedding, or weaker hair over time. Now, let's see if my scalp and hair are about to get the glow up they deserve. Cute. Vale.
All right.
Okay, so tell me, doctor, what are you injecting? We took the blood.
We spin the blood, separate plasma from rest of blood components. And when we do that, we infiltrate the growing factors from this plasma, actually platelets, in your scalp. And that is, you have like a layer in your scalp, with the skin, where it will be a concentration of platelets. It will be feeding somehow your follicles, and it will improve, huge improvement of the density of your hair.
I really want to see that.
All right.
You know, because I have extensions, so it's okay, no, to do it.
Yes.
No. A question: How deep are you gonna inject it?
The injection is 2.5 millimeters.
Okay, so
It's
like
right
tiny.
underneath the scalp. I'm gonna clean you up.
Yeah. Yeah. Okay.
All right.
Like I have a little bit, I don't know, how do you call it, or you are the expert for scalp, psoriasis or like dry skin.
Dry skin.
Yeah,
This is a dermatitis.
Yeah,
Yes.
but does that help also, let's say PRP?
Yes, PRP
With
will
that too?
improve the quality of all the skin underneath, as well as the scalp itself.
Because when I've done the PRP for my face, I really see the difference. So I can only imagine what it can.
All the skin improves a lot, so you'll see how it works. Just cleaning you up, and I will puncture with the needle, this short needle, right away.
Okay. Let's see, I'm not really looking forward to this part, but we do sacrifices. What do you think? I lost a lot of hair in the last 3-4 years.
All right, there we go.
Okay.
I'll do it quite fast.
Okay. Oh, wow.
Any pain?
A
little bit.
bit,
yes.
but like stinging more,
It is.
like little mosquitoes. So bad. No. It is worse for the face, I think. So if you've ever done it for the face, like this is much less painful. I guess there's less nerve endings in the hair, or?
I'm sorry?
Like, why is it less painful? Do we have less nerves, like in the face?
Yeah, the scalp is thicker. So
Okay, thicker skin.
It's a thicker skin, so you may not have that much pain. The nerves are underneath that scalp, so you may feel less than when you did in your face.
It's like little pinchititos, like, yeah, not so bad.
I will spread out all these platelets around the all the surface in your scalp, especially where I find out that you may have.
Where do you see, or where do you think?
I see you
in
have
the sides?
in the sides, your recedings. You actually do have quite large recedings.
But we don't know why that is, or do you know? Why is that like normal area? Usually
it is a normal area. There's a pattern that normally repeats most of ladies, and it's in the middle, and on the top of your where you dress your hair in the middle, and the top of the scalp and the recedings. Those are quite common areas where the classical FAGA, alopecia, female androgenetic alopecia, reveals.
So I guess
Alopecia is any type of
hair loss,
loose intensity in your scalp, in your head. And it's not properly a disease or anything like that. It's a condition. Actually, it's a genetic condition. And there's a pattern quite common where almost 30% of women do have any time in their lives. And it's called FAGA, F-A-G-A, female androgenetic alopecia, in a higher or lower degree, but you do have a low degree of this. That means that you have to treat these areas to prevent losing hair.
So PRP would be the best solution then? Or what else would you?
These growing factors from the platelets, yes, it will help.
And mesotherapy?
As well as mesotherapy. Mesotherapy is a generic name given for anything that you needle in the scalp or somewhere else in the body, but in the skin. But we have, personally, there are different type of mesotherapies, and I prepare the compound with the laboratory that I understand a woman may need, or a man may need according to their age, gender.
But what is, like, a lot of women say also when we get pregnant or when we have a baby, we lose the hair. Yes. Why is that?
Hormonal changes, they will eventually cause hair loss. It's quite linked, one thing to each other. But those are temporary loss of hair that you will eventually recover afterwards. We can avoid that as well with this type of treatments. We can avoid that loss of hair in different circumstances. But that's not the origin of the cause. The cause, as I told you, is a genetic condition. The epigenetic, the ambiental factors, may do as a trigger. Stress, anxiety, type of food that would eventually cause that anything that was supposed to happen in a few years could happen earlier. Could accelerate the process.
Okay, so less stress.
Yes, stress doesn't help.
No. That's why you put this beautiful waterfall. I feel less stressed.
hurts, doesn't it?
A little bit.
Yes.
But I try and think I try and think of the outcome. I try to visualize that you're like injecting gold. It will help my hair growth, and it's all worth it, and it's all natural. I like the fact that I'm quite into natural things, so I don't really want any chemicals in my body. I think we have those enough, so I like the fact that this is come from my own blood, my own own good, all the good things. So I'm visualizing Rapunzel hair. So you do mainly do it in these areas that you find, no, not like everywhere.
It will be everywhere. I did first. It was the first out of 4, right? So es una de 4, no? You have 3 remaining ones.
Okay.
3 more ones. Syringe. So I did the areas where I understand is more important, and now it will be done in the rest of the scalp.
That's right. Not so bad, actually. I thought it was going to be worse. And then I can't wash my hair for 48 hours. 24
hours.
Okay.
You can wash your hair tomorrow at this time if you want.
No, I think I try not to wash my hair I try to wash my hair every 2-3 days.
It's healthier washing your hair.
Yeah, often.
No, not often.
Oh.
On the contrary, you better wash your hair like a couple of times a week.
Yeah, that's what I do usually.
No more than that.
Every 2-3 days I try.
That's correct.
So I washed my hair actually yesterday, so I think maybe I'll also skip tomorrow.
All right. These remaining water or humidity that we leave in the scalp when we take a shower, when we wash our hair, that's very bad for the scalp.
Yeah,
Actually, it changes the conditions, the pH of the scalp, the remaining humidity. So it changes all this flora, this microbiota that we have in the scalp. We have Lactobacillus dermitis, Lactobacillus capitis. Many of those bacteria are good for the scalp. So if we wash too much our hair, we can change that ambience, and the pH changes. It's not good for the hair. This is the way we collect. It's called in a closed circuit, circuito cerrado, the plateless concentration. What should be done in these kids of closed circuit. That's what it should be done.
But what is better, mesotherapy or PRP?
Yeah, there's no way to say one thing or another. I mean, it depends. Actually, what works better is the synergy between both. It's a booster. The use of both things. That's what I recommend.
To do both.
Everything gives different properties. And I think the combination of both
shows results.
Will give you the best result. That's what you will do, actually. I'm gonna do both things in the next months.
I'm very intrigued because I really want to take off my extensions now and boost my own hair growth.
¿Cuál te duele más? ¿La de Carlos o esta?
Creo que este.
¿Qué te duele más?
Porque otro más rápido.
Sí.
No, tac, 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 ya está. Este. So he's doing a technique like Carlos did it quite fast, but he's doing another technique which is a bit slower, but I think, you know, must ¿Cuál es mejor? No hay,
Son
no?
diferentes.
Well, there's no better one. Either they're both fine, but yeah, I would say the other one hurts maybe a little bit more.
La otra técnica que es más rápida se queda más uniforme. Sin embargo, el punto a punto, sobre todo para personas que están trasplantadas del cabello un poquito más de fibrosis, más duro, cuesta más infiltrar, puede rentar un poquito más.
But it's not bad. It's okay. I'm just imagining my hair growing, visualizing. Trying not to think about the pain. But this is great. I can't really wait to see how my hair will start feeling. Obviously, you will not notice these changes tomorrow, but I think we're gonna need to do at least 3 times over the next one in 6 weeks. So over the next couple months, I will make sure I let you know how my hair is growing and how am I feeling. But yeah, this honestly is not so painful at all. So I urge you to come and check it out and see. If you don't need to do a hair transplant, you can just start with like boosting the hair growth. That's what they all want, I think. And you don't need to have it done with any chemicals or strange shampoos that you heard about. I think this is such a great way. So yeah, come to Medik. So I just finished the PRP for my hair, and as you see, like really, I don't have. I think a lot of women, we struggle with the hair on the sides, like we're losing the hair on the sides. So he did a lot of that here, and yeah, I can already wash my hair if I want, actually tomorrow. And I brought a hat, so thinking maybe I have to like protect my hair, but actually it's fine. It's no need, but I did put it. And yeah, and also Medik is located in Guadalpin Hotel in Marbella. I don't know if you can see. Such a beautiful hotel. So if anyone is thinking about a hair transplant, the cool thing is the clinic is right here, and then you can take an elevator and go up to your room. So it's like total privacy, and you're on the Golden Mile. You have 2 minutes to the beach, so you can have your hair done and have a holiday, you know. So yeah, I'm really excited to see what happens with the hair. And I'm thinking also, I have extensions, but I do think maybe I'm gonna how do you say, like raise them one more time for 2 months, and then I'll get rid of them for the summer. That's the plan. And then really do the PRP again at least 2 times and mesotherapy. And let's see, will I have hair like Rapunzel? My hopes are high, but let's see. Only time will tell.